My name is Sheena Litzen-Favai. I am a student at the University of Alaska Fairbanks, and I am also a Child Protective Service worker for the Alaska Office of Children's Services. This is a research proposal about self-care and burnout prevention in Child Protective Service and how worker perception should inform organizational strategies. Well known that burnout is a consistent problem for people working in child protective service, and CPS workers experience high levels of burnout, emotional exhaustion, and workplace stress. 60% of workers in the US report symptoms of burnout, and this is a big problem. Why does this matter? So high levels of burnout can lead to significant workforce and retention issues. CPS agencies across the US report between 16 and 60% turnover rate annually, and this is a compounding problem. And what this means in this context is that when a worker leaves, the workers who stay, their caseloads get higher. And with higher caseloads, often that brings more burnout. So it's sort of a repeating cycle, if you will. Writing research question for this project is, how do child protective service workers perceive burnout and self-care, and how can these perceptions inform organizational strategies that more effectively support worker well-being and reduce turnover? In preparation for this proposal, a literature review was conducted and there was a few key themes identified. Burnout being more than simple stress or fatigue, self-care requiring organizational support, and the importance of supervisory and management support. Burnout is more than just stress or fatigue. This is a theme that was identified across all of the data that was reviewed. Burnout is described as a state of deep emotional exhaustion, overwhelm, or moral distress, and it may even mirror symptoms of PTSD, such as difficulty sleeping, reoccurring distressing thoughts, and a reluctance to engage in caseload. There were also some lesser known factors observed in the literature. I think most people, when they think of CPS practice and the impact that it might have on a person's wellness, they think about exposure to trauma or crisis situations, and all of those things were noted in the data. But there were some lesser known things, such as the negative perception of CPS agencies having a significant impact on worker well-being, as well as the ethical and moral tension of working in a historically and sometimes presently harmful system. And what this looked like for some of the workers was having to make decisions that may have aligned with practice or policy, but didn't align with their personal values, or felt that they had to make decisions that were really difficult and they may not agree with. Another reoccurring theme in the data was self-care requiring organizational support. I think it's pretty well known at this point across a wide variety of professions, from healthcare workers, first responders, and of course CPS workers, that self-care is effective, but the impact is limited without organizational support. So in the literature, there was a strong emphasis on the importance of collective responsibility for self-care and for worker resiliency, rather than the responsibility being placed on the individual, and how sometimes if all of the responsibility for wellness and resiliency is placed on the individual, they are much less likely to engage in those activities, and it's going to be less effective overall. So workplace cultures that promote collective resilience rather than individual responsibility came up again and again, as well as leadership attitudes and overall culture towards self-care and worker well-being having a strong impact. And that leads us to the third theme, which is the importance of supervisory and management support for overall worker well-being, and also for workers' willingness and ability to engage in self-care and work towards burnout prevention and resiliency overall. There were some significant limitations in the data that was reviewed, one of which being the limited participant diversity. So people of color, Alaska Native, American Indian people are disproportionately represented in the child welfare system, both in Alaska and across the country. But almost all of the participants in all of the studies I was able to review for this proposal were white caseworkers. And nearly all of the participants in the literature reviewed also had secondary education. So in a lot of agencies and a lot of places, it used to be the standard that caseworkers had to have a relevant degree, at least a bachelor's degree. But due to some of those retention issues that we already discussed, that has been lowered in a lot of places. So in Alaska, for example, it is not a requirement to have any kind of higher education past a high school diploma or relevant experience. For this study, I am proposing a mixed methods design that would consist of two phases. The first being a quantitative survey, will be a short survey with an emphasis on Likert scale questions to allow workers a few more options to accurately describe their experiences in a survey form. And the survey would focus on measuring burnout, self-care frequency, and some of the organizational factors that might be at play. Those results would be linked to the interviews using participant ID numbers so that the interviewer in phase 2, the qualitative interviews, would be able to have and reference those surveys to inform the interview. And then the interviews would be semi-structured and narrative focused. The reason for the narrative focused or story-based interview format is partially because it allows the participants to more fully express and explore their own experiences, to make meaning in their own words. It would allow the interviewer to sort of follow the participant to talk about the things they want to talk about, which, as we would get into the research, could be completely different than what we anticipate. And so rather than a set list of questions, we would want to lean towards narrative. And the other reason for this being that narrative-focused interviewing is a pretty standard tool in CPS practice, so all participants would be familiar with this style of communication. And these interviews would be used to deepen the understanding and explore patterns in the survey data. Approximately 12 people would be the proposed sample size, and the sample would consist of current CPS workers with at least 1 year of experience within the Alaska Office of Children's Services. The sampling would be done by identifying workers through professional contacts who might be willing or able to provide valuable insight, followed by snowballing recruitment, so asking those participants to reach out to people they think might be able to help with the study. And there would be a priority placed on diverse voices. So trying to interview caseworkers with all kinds of backgrounds as well as different roles. So there's two main roles for caseworkers within OCS, which is family service and investigations. So we want a good mix of both of those, as well as a diverse group of ages, education levels, urban versus rural workers, to get as many perspectives as possible. Once a participant signed an informed consent form, they will receive an electronic survey delivered in their email. And then once that survey is completed, an interview would be scheduled. There would be an emphasis on in-person interviewing when possible, but due to the geography of Alaska and caseworkers being spread out all across the state and wanting a wide variety of office engagement, a video conferencing option would also be made available. Interviews would be audio recorded and transcribed with all identifying information removed from the transcription. The data collected would be coded using open and axial coding as well as thematic analysis, and that would be compared with the quantitative data collected from the survey to identify patterns to further explore. And the data would be compiled and shared with OCS as well as published, so the findings would be available for academic and other agencies across the country. As I mentioned, I am a CPS worker myself, was obviously the inspiration for this proposal. And taking this class has really opened my eyes to how important research is and how relevant it is to really all sorts of social work practice. So for me, as a worker, I had so many ideas and perceptions and things that I wish my leadership or my agency might consider. But how could I start to implement those changes? And doing this project kind of helped me understand that a lot of times research is sort of the start of policy change, and that's why it's so important. So I really enjoyed it. I'm looking forward to finding ways to implement research into my practice in the future, both academically and, of course, at work.